Hello, my name is Jeff Okeson, and I am Professor and Director of the Orofacial Pain Center at the University of Kentucky. I also am the Program Director of the Orofacial Pain Graduate Training Program in Orofacial Pain, which has been Commission on Dental Accreditation approved. And I'd like to tell you that I'm going to have the privilege of coming to Mexico City on September 9th and 10th. Now, I've been to Mexico several times to lecture, but I've never lectured in Mexico City. This is my first visit to your city, and I am very excited about coming in September. And I want to share with you just for a moment a little invitation of what I'm going to be talking about during those 2 days. I think every dentist needs to know something about TM disorders. And here's an interesting study that would suggest that. During the last 12 months, 1 out of 6 patients in dental offices came to the office because of pain. And what's interesting, and what you'd expect, most of it was toothaches. However, the second most common pain complaint was musculoskeletal, or TM disorders. That means that probably in the next 10 patients you have, 1 of them will have some musculoskeletal pain. And if you, in fact, look at the statistics on this, 10 to 20% of the patients in the general population have musculoskeletal pain. And 7% seek care. These are things that we dentists need to understand, and what I'm going to be talking with you about is how you can appreciate these. And this is part of dentistry. And if you're a general practitioner, this is important. If you're a prosthodontist, this is important. If you're an orthodontist, this is important. If you're an orthodontic surgeon, this is important. Because what I'll be talking about is how this system comes together. I'm going to be talking about the importance of occlusion. Occlusion is important in dentistry. And we're going to talk about orthopedic stability. In other words, developing occlusion in a sound relationship, which is in harmony with the musculoskeletal position of the joint. We're going to ask the question, is occlusion important in dentistry? And of course, it is important in dentistry. It's the foundation of developing a sound masticatory system. However, another question that we ask ourselves, is occlusion important in TMD? Well, that's another question. And I'm going to talk about that during this presentation. We'll talk about these factors that are involved with TM disorders. Where does occlusion fit? Where do dentists fit in solving this problem? And we do have a place, because one of the etiological factors is occlusion. And if we dentists come in there, we can change occlusion. We're the only healthcare providers that can do that. And if this happens to be the reason for this patient to develop a TM disorder, and you resolve this occlusal, you establish better occlusion, you know what happens? That TM disorder resolves. And when it resolves, they become a happy patient. And you've done this with your patient. You've changed people's bites and they felt better. But the frustrating part that we face is that sometimes other etiological factors are the important issues. And maybe these other factors are doing this, and we go in there and change a person's occlusion, and you know what? It has no effect on the pain. And that's frustrating for us. What I'm going to be talking about is how you can select the patients who have pain conditions that are associated with our structures and occlusion before you start changing people's occlusion, which is how you what you'd like to do to be a better healthcare provider. We're going to talk about those, how you identify those things. We're going to talk about TM disorders, which are musculoskeletal pains of the masticatory system. We're going to talk about them as a variety because they're not all the same. There's a whole variety of different conditions, and I'm going to review some of these conditions, and it's important we identify that because they're managed differently. We can't call these patients TMJ patients and expect to help them, because TMJ means all of these and all of those conditions are managed somewhat differently. And then I want to put in perspective with you, because TM disorders is only one type of orofacial pain. And therefore, orofacial pain is the big, broader scale that we need to appreciate as dentists. And this is the classification I use in Bell's orofacial pain, which is another textbook that I have. All of these are conditions that walk into dental offices with face pain. And yet TM disorders are only these that are in yellow. And we as dentists need to understand those because that's what we treat. We are the only healthcare providers that treat TM disorders. But sometimes if it's one of these other conditions and we treated TMD, they don't get well. So we need to appreciate all the different pain conditions, and I'll be highlighting some of those. We'll be highlighting some of the normal function of the joint. I mean, this is our joint. We need to appreciate how it functions. We also will then appreciate how it dysfunctions with things like clicking, popping, locking. And we'll talk about not only those, but how to manage those patients in your practice setting. We'll talk about the idea that when this thing called nociception comes in, it's perceived as pain in the cortex, and yet things can change in the processing of this information, and when it changes, all of a sudden another area of our sensory cortex becomes excited, And then what we start to see is 2 areas of pain. And this is called pain referral. And we need to appreciate pain referral because it happens in the head and neck a lot. In fact, in my opinion, it's one of the most primary reasons for misdiagnosis, which means treatment failures. We need to understand that. We'll be talking about that. We'll be talking about occlusal appliances. When to use them? What types of appliances should you use? What kind of conditions? I'll be reviewing muscle pain and joint pain. And we may be using 2 different appliances for those types of patients. We're also going to be talking just a little bit about dentoalveolar pain. What is that? It's a type of maybe neuropathic pain felt in teeth. And I hope I have an opportunity to share with you the mechanisms by which people can have toothaches that have nothing to do with the pulse and periodontal structures. We need to identify that way before we start doing root canals and extracting teeth. And so these are some of the subjects that I'll be sharing with you in Mexico City, September 9th and 10th, Friday and Saturday. And I'd like to invite you to come join with me, and we'll share this information. Hopefully it will be something that will be very useful for your practice setting, because you do have patients that have these complaints, and you want to be the best health care provider that you can. And you can provide some of this care in a very conservative way often. Sometimes you don't need to make big changes, and we'll be talking about some of those conservative things. So if you're interested in coming and visit with me during that time, I hope I'll see you there. And at the end of this video clip, you'll have all the information on how to sign up for that course. I look forward to seeing you in September.